The newborn had been home for 6 days. The golden retriever had not left her side for any of them. They thought it was sweet. They had no idea it was something else entirely. She was 12 hours old when they brought her home. That was when Maple decided. Naomi and Cal Reyes had waited 4 years for their daughter. June, 4 years of paperwork and hope and loss and revision that had ended with a healthy newborn girl placed in their arms in a hospital room on a Thursday morning. In late September, they drove home in the kind of careful, reverent silence of people who understand what can be taken away. Maple, their 5-year-old golden retriever, met them at the door. Naomi had prepared her for this, a carrier worn during late pregnancy. June's hospital blanket brought home the day before to let Maple acclimatize to the scent, the standard protocols from every reputable preparation guide she had found. Maple had been patient and gentle and undemanding through all of it. What she had not been prepared for was this. The moment June was placed in the bassinet, Maple sat beside it and did not move. 6 days later, she still had not moved, not substantially. She ate her food when it was brought to her in the nursery. She accepted being walked 3 times a day and returned immediately to her post. She slept beside the bassinet. She was there at 2 a.m., at 4 a.m., at dawn, when Naomi came in for the first feeding of the morning. Naomi was a neonatal nurse with 14 years of experience in the NICU. She worked with premature and fragile newborns. She understood infant physiology at a level most parents do not. She had watched the monitors on dozens of newborns who needed watching, and she had come home to a healthy full-term daughter with good APGAR scores and no identified risk factors. And she told herself that Maple's vigil was a personality expression, a dog who had found her person and was claiming the relationship. She told herself this clearly and professionally, and believed it. She was not wrong that Maple had found her person. She was wrong about what Maple was doing there. On the morning of day 6, June cried for a feed at 5:40 a.m. Naomi came in. Maple was standing rather than lying, which was the first thing that was different. She was standing with both front feet on the bassinet rim, face over the side, nose actively working. If you stay for stories about what animals sense before we do, you are in the right place. Subscribe so you don't miss the next one. Naomi lifted June. She was crying in the ordinary way, the flat, rhythmic cry of a hungry infant, and she felt warm, which Naomi noted, and she felt wrong. Not dramatically wrong. The particular kind of wrong that 14 years in a NICU teaches you to locate without yet being able to name. A degree of tone that was slightly off. A quality of cry that was 1 register off the baseline Naomi had been building internally since day 1. She took June's temperature. 100.4. In a 6-day-old infant, 100.4 is not ordinary. It is the number that neonatologists use as an automatic threshold for emergency evaluation. Naomi called her hospital. She was seen within 40 minutes. June had a urinary tract infection, an early treatable. Caught before it became serious presentation of a condition that, in a newborn, can escalate to sepsis within hours if untreated. Dr. Carla Mendez, the attending physician in the neonatal unit, told Naomi something she did not expect. UTIs in neonates are not typically associated with visible distress in the early stages. The infant may not cry differently. They may not show fever for many hours. The scent profile of the urine, however, changes measurably in early, and in a dog with the olfactory sensitivity of a golden retriever. That change is detectable through a bassinet, and through clothing, and through the ambient chemistry of a nursery room. Maple had been sitting beside that bassinet for 6 days reading June's chemistry. She had stood up on day 6 because what she was reading had changed. Has your dog ever done something that made no sense until it was the only thing that made sense? Tell us in the comments. These stories deserve to be heard. June was treated with a course of antibiotics and discharged to home care within 48 hours. She is 8 weeks old now and completely healthy. Maple sits beside her bassinet with the same consistency she has always demonstrated, which Naomi now reads differently than she did before. Not as a personality quirk, not as a bond expression, as the sustained attention of an animal who has a job she chose herself and intends to continue doing. Cal made one observation. On the evening June came home from the hospital a second time, he said that in all of his life, across all of the dogs he had loved, he had never once thought of one of them as a clinician. Naomi said, "That's because you never watched them closely enough." Every guardian deserves to be recognized, even the ones who never asked for anything in return. If stories like this matter to you, subscribe so you never miss the next one. On a Saturday morning, 3 weeks after June came home the second time, Maple was in her spot. June was in the bassinet. Naomi was in the chair by the window with her coffee. The light was coming in sideways in the particular way of fall mornings in their city, touching the side of the bassinet and the edge of Maple's coat, and June's small closed fist resting on the surface of her sleep sack. Naomi watched the three of them, the light and the dog and the daughter she had waited 4 years for, and felt something she did not have a clinical word for. She had a different word for it. She used it quietly, to herself, in the chair by the window. Gratitude has a specific weight when it comes after understanding. This was that weight. The next story involves a rescue dog who was 2 hours from euthanasia, and the family who brought him home the day their son's diagnosis changed everything.